Okay, so we're gonna do how I do my dressings changes. I already took off the ace wrap and then this like sock thing they had under it because I was laying on the couch and it was really irritating me. So story short, I had hardware taken out of my knee like 2 weeks ago, I think. And then the incision got infected with staph, and I had to have emergency surgery almost a week ago now for them to clean it out. And so now I had to be really careful with my incision. I'm on super strong antibiotics. I also am having issues with skin irritation and getting hives from the stuff they use, and that is my dog Apollo. So I'm going to be doing it a little different than how they had it. So I'm just going to finish undoing this bandage. I'm supposed to be keeping compression bandaging on it because of the amount of swelling I've had. This swelling won't look bad now, but when the compression's off, it swells up again really quick. So what they had underneath, this yellow stuff is zero form. It's like a post-surgical dressing with like antibiotic and then just like gauze. And this like gauze cotton was to try and make my knee feel a little bit better. But as you can see, the incision's actually looking really, really good. Nothing compared to how it looked a week ago. I'll pull up a picture and show you what it looked like prior to the emergency surgery. It was pretty bad. So I don't know if you're going to be able to like see this very well. Yeah, it's not going to work seeing it on my phone, but prior to the surgery, it got really red and it almost looked like a funny red rash that spread down my leg, but it was staph. So I'm going to start by cleaning it. Sorry, it's still really itchy. The skin's just irritated. So we're just cleaning it because there's still technically open parts to the wound. But a couple of these povidone iodine sticks left, and then after that I'll have to go buy some in the bottle, but I'm just going to rub this down center of the incision. Sorry, my hands don't work very well all the time. My fine motor skills aren't the best from nerve damage. And then I'm going to go down either side because where the sutures are, there's also open skin. And where the old sutures are that they had to take out for the emergency surgery. I hate this stuff though because it has adhesive in it and I'm allergic to adhesive, so it doesn't help that matter. And I'm not supposed to redo a side, but I just wanted, this one's more wet. Okay, so that's that. Zero form. This is unfortunately the last pre-cut one I have. It looks like, just like the package is like that. When you open it, it looks like that. It's kind of gooey with like a petroleum-like texture on it, but it's like medicated. So I'm gonna lay it down, and I like it to be a little longer the incision because when I bend my knee, it pulls up a little bit. And then I like to press it down some. So I got permission to leave the ace wrap off when I'm like resting, but if I'm up and moving around, I'm supposed to have it on, and I should have it on most of the time. Because of that, the ace wrap's what was holding on the gauze before. I'm gonna have to, and I'm supposed to leave these thick. I'm gonna have to like tape, but I'm allergic to tape, so just the lovely complications of my life. But I have some silicone tape I'm gonna use to just kind of tack it down. And these are just 4x4 gauze pads. And they want them thick because when we wrap it, it's going to apply pressure to the incision. This is silicone tape. You can get it at like, I think CVS sells it, but there's NextCare has a brand too of silicone tape or hypoallergenic tape. It's nice stuff. It works. It works well if you're putting like an ace wrap or something over it. But if you're going to use it like, say, on your leg and you wear pants over it, it's most likely just going to roll up and fall off. And never use it to secure a feeding tube. Learned that the hard way one time, but it does work to use as like a duoderm that you would put like under the tube. And then just make sure when you secure tape to it, there's still a little bit on your skin. But this stuff's awesome. So this is just going to help hold it down for when I have the ace wrap off so those gauze pads don't fall off. And last one. And I always like to have my knee a little bit bent when doing this stuff, just because when you bend it, everything like stretches and you don't want it to pop off. So if I was doing like prior to the emergency surgery, I would just do that yellow stuff and I would do thinner gauze like this, and then I would put Tegaderm over it. But I'd always put the Tegaderm on with my knee bent this much. So that way I knew when I walked and stuff, I could still bend my leg. Because if I had it completely straight and I put it on, there would be no room to like bend the leg. And that stuff does not stretch. But then I also prefer to use IV 3000 instead of Tegaderm because it doesn't irritate the skin as much. But it's also not a complete seal like Tegaderm is. So you have to keep that in mind. But that's how I change my dressing. And then, well, I'll show you how I do the wraps as well. This stuff comes unraveled, so I just have a piece that I cut a while back so I can keep it from all unraveling and going everywhere. Okay, so those who have never really understood how to wrap an ace wrap properly, so when you look at it, darker side, this side's a little bit paler. This is the side that would go against the skin, and this is the side that would go up. You'll notice that when you hold it up, this Velcro is facing one way. This Velcro is facing the other. I'm going to take the Velcro that would be facing down when looking at it as if it was wrapped on. And I'm going to fold it back. I'm going to attempt to fold it in half just to try and save this ace wrap. But I'm going to wrap this up now. A lot of people get confused with how to do an ace wrap roll if they don't use them often. And it's funny sometimes when I'm working in the hospital to watch a patient try, and I'm like, you know, you just did that completely backwards. Let me show you the easy way. All right, so whenever you get a brand new one of these, it's always set up like this. You want to hold it like this. The rough side of the Velcro is up. And then you're going to leave that up because and I like to put it over the gauze so it doesn't irritate as much. Which, hold on, let me back up. I need to put this guy back on first. This is just to provide a barrier between my skin and the ace wrap. Most people don't do this, but my skin is wonky and I have so many random allergies, and it was every time the ace wrap would like pinch and stuff, since I have to wear it all the time, it was just creating so much skin irritation. So we're trying this to see if it helps a little bit. And it helps some, not a lot though. All right, so back to the ace wrap. Holding it this way, Velcro side up. And the reason I'm not wrapping like some of my leg with this is just because this ace wrap, they should have given me a thicker one, but they didn't. This is like one you'd use on an arm. So that rough side's up. Then you're going to bring it around, and it's going to like Velcro there. And it's going to just help hold it so it doesn't loosen up while it's on. always go from distal, which means farther away from the trunk, to proximal, which would be coming towards my trunk meaning shoulders to like your groin, so this middle section of your body. So I'm going to go up and I'm going to pull it tight as I come under and behind, but then I'm going to let up on the tension as I'm coming down the side of my knee. And this is how you prevent it from getting too tight. So up, I'm going to pull, tight, tight, tight. I'm going to let up the tension here. Now, as you can see, I got to the top of this, so I am going to have to break that one rule. But as I go back down my leg, I'm going to keep this loose. So that way, I'm not trying to push my circulation towards my foot. The reason we go from here to here is we want to push the blood back towards our heart. But if I just leave this loose as I come back down, so now I'm back down here, now I can pull it tight again as I come in the direction of the heart. And then you Velcro it. And now I have a nice little wrap, which is providing compression to my bandage and to help with the extra fluid in my knee. So, and that is all. That's how I do my dressing change. All right, guys. Bye.